Okay, so here we are. I hate to say I saved the best for last. I saved the one I know personally for last. Breast cancer is the second most common cancer in women. It is second only to skin cancer. 6 months ago today, I was in the hospital and I had a bilateral mastectomy. 6 months ago today. And the past 6 months have been scary. Everybody says, oh, you're so brave, but I'm not. It is very scary. But I'm going to share a little bit about what I've learned about it. And I have learned that you should do your self-exam because I found it myself. And it didn't matter that I'm a PA and I found it. I found it just because I did my self-exam. And it's not anything that you have to be extra trained at. You just have to do it. And what you need to look for is something different in your breast. It doesn't have to be that, oh, I'm looking for this little pea-sized spot that does this or that. Just something different. Know your breast. Know your body. Self-exams, 40% of all breast cancers are found by self-exam. You should have a monthly routine where you do it midway of your cycle, if you're still having cycles, and be familiar with your breast. Do it 3 different ways. You want to do it in the shower, you want to do it in front of the mirror, and you want to do it laying down. When you do it in the shower and you do it laying down, you want to put your opposite hand above your head to stretch your breast tissue out and then use your hand to come across. And you can do it 3 different ways. You can do circles around your breast, and you want to be sure and get this little tail of tissue that goes under your arm here. Then there also is, medically, we call it the cogwheel pattern, but I'm a foodie, so I'm going to say it's the pie pattern, and you just kind of go, in little sections, filling, and using your finger pads to feel deep and push. And then there's a pattern where you can go up and down, just kind of back and forth like you were, a mower going back and forth. So you can do circles, your cogwheel patterns, or your up and down. And then you're going to swap and do the other side. And then you do it in the shower, do it laying down. And then in front of the mirror, what you want to do is you want to look at it. You're going to hold your arms up, and you're going to look for dimpling. You're going to look for changes in your skin color, changes in your skin tone, like thickening. And then you're going to put your hands kind of behind you and pull your chest back so that you can see any dimpling. Just look, feel, and just be aware. Clinical exams with a medical provider, you should have at least every 3 years when you're 20 to 39. And I try to tell, again, when I'm doing pediatric patients that as soon as you start to develop breasts, start doing your breast exams. It's a good habit to get into when you're young. We have breasts and we need to take care of them. So I try to start teaching my patients early on how to do it. And then I also try to tell my patients when I'm doing a women's exam and I'm doing a breast exam, how I'm doing it, and talk them through it so they understand. Because I've had people come up to me and say, I don't know how to do a breast exam. Will you show me how? And if you don't know how to do a breast exam, come see me. You don't have to see me at the clinic. Come see me afterward. Get online, YouTube it. There's all kinds of videos. But become comfortable with doing your own breast exams because it's really important. After you are 40, they recommend that you have an annual exam with your medical provider. The older we get, the more risk we have for all cancers. So you want to get examined more. And mammograms. They recommend that you have your first mammogram at 40. And again, this guideline is personalized based on any family history you have or whether you feel something or anything that might be going on with you. But the guidelines right now say 40 if you have no positive family history and you're not feeling anything. Now, the guidelines say every year or every 2 years. Again, based on the different groups. I say every year. If you go 2 years and you find something after you've had that 2-year wait, are you going to regret that you didn't go 1 year? Yeah. But are you ever going to regret that you went 1 year and didn't find something? I don't think so. So I'm a fan of going every year. When I found the lump in my breast, it was time for my mammogram. But if I had gone 2 years and I didn't find it myself, it would have been way too late. So I'm a fan for every year mammogram. I don't have any patients that are like, oh, I don't want to. Some people don't like to have a mammogram. It never was bothersome for me, but if you don't like a mammogram and you think that your breasts are tender, take some ibuprofen before you go. There are things to do that will help you, but go have your mammogram and work with the person that's the mammographer that's helping you. Tell them you're tender. Tell them, they will be very patient with you and help you through it. But have your mammograms, and I say have them every year. Okay, this is something that's dear to my heart too. When you look better, you feel better, and when you feel better, you heal better. And I believe it. So when I found out that I needed to have chemotherapy, the very first question I said is, okay, am I going to lose my hair? And they said, within a week. I was like, okay, well, I'm not letting it fall on the ground. I wanted to be in charge. I mean, y'all women like that want to be in charge. So I'm like, I'm not letting my hair fall out and it go to waste. I'm going to donate my hair. So I went and had my hair cut short, and I donated my hair to Locks of Love. I thought I was all good with this. And then I thought, oh my goodness, my daughter's getting married. I don't want to be in her wedding pictures bald. So I had to regroup. And I thought back to the very first day that I was with Dr. Boyd, and he told me that 8% of all patients just say, I'm not doing anything. If I have to have chemo and I'm losing hair, I'm not going to do anything. And they just refuse treatment. And I would never do that. I want to live. But it is a very traumatic, emotionally, to think about losing your hair. And then to think about getting up every morning when you are sick and you're going through treatments and look in the mirror. What a reminder to see yourself looking sick. It's really a hard choice to do. And then also I have run into lots of patients that they want to be private. I'm not a very private person, I guess y'all can tell, but there are some patients that they want to be private. They don't want their family to know even. They don't want their coworkers to know. And so if they lose their hair, they can't be private. Or they don't want their young children to know, because there's young mothers out there. I'm amazed and so thankful that I'm not a young mother with breast cancer, that I'm an old mother with breast cancer. But, there are women in my forum that are breastfeeding their babies and find out they have breast cancer and they're having to stop, or they're pregnant even. And so they don't want their young children to see them sick and scare them. So they have lots of reasons for not wanting to lose their hair. And then there are men too that they don't want to lose their hair. So in thinking of that, my oncologist at Vanderbilt, that very first day, she said, well, there's this new thing out called Scalp Cooling, and you just freeze your scalp, that's all you do, and your hair won't fall out. And I was like, Laura was with me, I was like, no way, I don't like to be cold, I hate to be cold, it hurts me to be cold, I will lose my hair, I'm okay, I'm not interested in that. So I just filed that away for a while. But after, having my surgery and waiting for things to heal and to get ready to start chemo, it hit me about Laura's wedding, and I was like, maybe I need to think about that a little more. So I started investigating it, and it was much more complicated than what she explained to me, because at Vanderbilt, where I was going for my oncology care, they have a lady that does it. And of course, in Nashville, there's a bigger city, they have lots of different options. So they have dry ice, and they have these things accessible, and they have private rooms for chemo, where here we have a big room where we all do chemo together. And I couldn't get my logistics around it working. But this picture here is a scalp, a cold cap, and they were introduced in Europe in the 1970s. I always thought in the United States that we were breaking edge technology, but I am finding that we're behind on a lot of things that's simple, because this is such a simple technology. The manual caps are -15 to -40. That's very, very cold. There are several companies that make them. There's Penguin, Arctic, and Kimbo caps are the most common ones. And what you do is you lease these from companies, and they're about $500 a month to lease them. And it depends on what chemo protocol you have to have as to how many months you're going to need it. But then you have to buy dry ice and get it iced down. And you have like 4 caps, and you alternate those caps on and off of your head every 20 to 30 minutes because your body's warming it up quickly. And as a patient getting chemo, you can't do it yourself because you have to pull it down really snug, and then it has Velcro straps that go this way and Velcro straps that go that way. And I mean, it's a tight thing. So you have to have somebody there with you, and you have to do it so long before you start your chemo infusion, through your chemo infusion, and so long after. For instance, with my chemo infusion, I would have had to cold capped with these manual ones an hour before my infusion that I needed it for an hour, and then 4 hours after, which would have been 6 hours of putting that cap on and off my head. I can just imagine how tired my neck would have been after everybody had pulled and tugged on that. And I also could not imagine, I had so many friends offer to help me, and my family too, but I just couldn't imagine putting that responsibility on somebody, because one change and you not get that hat down, you're going to have a bald spot. And so on my forums, you can just see people, like they'll have a bald spot in their crown, and they'll have, you know, it's just a hard thing. So those girls that do the scalp cooling with these manual caps, boy, they're heroes. I can't imagine doing it. The other thing about the manual caps is they're not FDA approved because there's too many variables. You just can't measure all that and get it all set distinctly, so they can't be FDA approved. So along comes cooling systems, which I'm so very thankful for. And in doing my research and realizing I couldn't get the logistics together for the scalp cooling, I realized that they had the cooling systems, but there wasn't one in Tennessee. But we found one in Kentucky, and I did some research and thought I would just go there and get my chemo, but they were out of network. I mean, you know, I have to do with my insurance too. I've learned a lot about insurance as being a patient. But there are 2 FDA-approved cooling systems. We have the DignaCap that's out of Sweden, and it was FDA approved initially for breast cancer. And these were all tested in breast cancer patients first. Y'all know why? Because they're females and we want to keep our hair. So they did those tests first, and then they were FDA tested and approved for solid tumors. So they got FDA approved for solid tumors in 2017. The machine that I use is the Paxman. That's what's pictured there in that photograph. And it's from the UK, and it was approved for breast in April of 2017. That recently, April of 2017, and it's been in the UK for 20 years, y'all. 20 years. So it was approved for all solid tumors in just June of 2018. So it's that recent. Neither one of these are approved for lymphomas or leukemias or brain tumors, because they say, you know, if there's something going on in your head, they want you to get as much chemo up there. They don't want to risk any decreased circulation. But the way it works is it freezes your hair follicles so that your chemo doesn't cycle through your hair follicles to damage them. Okay, so this is me getting ready. This was so simple. It was so much simpler than using the manual caps. I had to wet my hair, and then they had a little headband I put around, and it protected my forehead and my ears from getting too cold from the cap. And then the blue is actually the cap that saved my hair. It has a coolant that is in those channels, and it plugs in. It has, see the little tail hanging over my shoulder there? That is what plugs into the machine, and it cycles the coolant through over my scalp. And then the last picture over there is the neoprene-like cover. It's almost like a very, very tight swim cap. So you have to pull it down, and it has all these strings and drawstrings that you cinch and pull tight. It's a whole lot easier than the manual caps, where it has all these Velcro straps. And then it has this chin strap that you pull. They told me I looked like I was a football player when I had my cap on. So there I am, all set back. I think that was the day Laura went with me. And it is very cold. It is not horribly uncomfortable as I feared it would be. When I would first put it on, it was like, somebody described it like you jump in a cold swimming pool, and you know how you're really, really cold for 15 minutes or so, and then you acclimate. It's kind of like that. After I would get started, I wouldn't be that aware of it. It was worse. I also had to ice my hands and feet because my chemo caused neuropathy, and my oncologist was like, you don't want to take a minute of that medicine without icing your hands and feet. And I will say it was much harder to ice my hands than it was to do the hat. My feet, I didn't even care that they were cold. My hands being cold was not fun. But it wasn't so bad. So, side effects, they say chills, dizziness, headache, nausea. I was just cold. I didn't have any of those headaches. I might have had a headache the first time, but I don't think I really complained about any of that. It was just a little bit cold initially. I did take hot chocolate, and my blanket I had was a plug-in electric blanket, and so I was toasty everywhere but my head and my hands and my feet. So, and probably one of the most complicated part was hair care. They recommend that you that you use mild products. They actually, in my kit that I bought to do my cold capping, Paxman had a kit that included my cap and some shampoo and conditioner and all. So I use their products, and then they recommend that you wash it only 1 or 2 times a week. So if you're used to washing your hair every day, it was a big change. And that when you wash it in cold water. That was harder probably than wearing the cap. But I learned to get in my bathtub and sit in hot water and hold my head over that way so that it didn't come down my shoulders. You know, you learn. So I figured out how to do that. No drying, no curling iron. I don't use the curling iron very often anyway, and it's too much trouble to use a straightener. But if you're one of those people that does a lot of styling with your hair, it's a go natural hair kind of time. And then no coloring. So I was really dreading no coloring. I was worried about how much gray I was going to have because I've colored my hair for a long time. But, well, I have learned a secret. But I am surprised and pleased that I didn't have as much gray as I expected, and I am appreciative for every gray hair that I have now. But I did learn from my cold capping forums that L'Oreal makes this great spray that you can use and it just washes out. So, you know, you just color your roots when you want to. So I have used it a little bit, but I really didn't have as much. I figured I would go completely gray, but I didn't. So yeah, it looked really good. I was very lucky, very lucky. Okay, so before I go on that, I'll just say I want to give one more plug to cold capping. We have the only scalp cooling device in Tennessee, right here in Henry County. I'm the only person that's used it, and I'll say it's not a cheap machine to use. I had to pay to use it. I got it here, and we've got it here now, and I want it to be here, and I want people to be able to afford to use it. I have taken forms up to the Cancer Center and left for people to apply for financial assistance if they need it. You buy your kit. The way Paxman works, you buy your kit, it's $500. That's what everybody has their own personal cap, and it's like you get a prescription for it. It's like a durable medical equipment, like, you know, if you need a hospital bed or a wheelchair, it's a durable medical equipment. So I have that cap, and it's mine forever if I need to use it again. And it's assigned to me, and it has a little fob, and it turns the machine on. So the machine won't turn on for just anybody. Then that cap, the way the fob is controlled, it sets the fee per treatment. So you pay per treatment, but it maxes out. And so a lot of people need 4, you know, for breast cancer treatments, a lot of people do 4 treatments. And I'm not exactly sure. I think it's $1,200 with the kit to do 4 treatments. It was $2,200 for me to use it, and that's the max you pay. I had to have 12 weekly chemos, and I finished my chemo at the end of February. I would still be bald, y'all, and I'm not. I have a great head of hair. So I'm thankful every day when I go to work that, you know, my patients don't look at me and think I'm sick. My sister and I just went on a trip this weekend, and people didn't know that I have breast cancer or that I have just finished chemo. I feel like I'm kind of incognito a little bit sometimes, but that's good, you know. But we are the only place in Tennessee that has this machine. I hope nobody ever needs it, but let your family and your friends and your loved ones know that it's here. I had a lady call me the other day wanting to know about it, and she wanted to go to Vanderbilt still. And I go to Vanderbilt for my oncology care, but I got my treatments here in Paris because it was convenient, and we are so lucky to have the Cancer Center here, and Dr. Rayo is a generalist oncologist versus I go to a breast oncologist, and he has been so kind to collaborate with my breast oncologist. And she told me, you know, if you get there, and she was very comfortable with me doing my treatments here. She said, if something happens and you don't tolerate it well and you need to change, Vanderbilt has this wonderful app, and within a day they get right back to you. She says, you send me a message and we'll be right on it. We'll tell you what you need to do instead. And she and Dr. Rao have talked, and, you know, she sends her notes to him and him to her, and it's been a great partnership. But you can't go to Vanderbilt and use this. They don't have it there. They use the manual. Well, you have to rent and take your manual caps in and your friends and whoever to change your cap. Where I went and I plugged in for 30 minutes before my infusion. I did it an hour during my infusion, and then I did it 90 minutes. So I did a total of 3 hours cold capping when it would have been 6 with manual. So it's so much easier, and we're so fortunate to have it here. And
you know, I don't want anybody to lose their hair and stress over it if they want to have access to it, because it's here now, and I hope we can keep it. But somebody's got to use it besides me for us to be able to keep it. So, you know, but just when you're diagnosed with cancer, there's so much to think about. That was on the end of my list. You know, I had delays, and it gave me time to think about it. So if you will help anybody you know that is diagnosed, and let them know that it's here, and let them know that it's something they can look into, they can call me, they can call the cancer center. The nurses there are new to it, and so, but they're very helpful, and they're trying, and they call me a lot too. You know, they have to fit you with the cap. The cap is, they have different sizes, and you got to get the right size. So there's a lot to it, but I just think that we're so fortunate to have it here, and so I hope that other people will benefit from it as well as I did. So, to wrap up, want to schedule your Well Woman's visit. If you haven't been to see your medical provider within the last year, you want to give them a call, talk to your doctors about risk factors for disease, and how you can stay healthy, because you want to lower your risk for all these chronic illnesses. If we catch them early, you're much more likely to do well. So work with them to develop a wellness plan for you.